get started. Okay. So, does anybody have any specific questions related to what was discussed in the lecture on disaster nursing? Any burning questions? No. Okay. Everybody, turn on your cameras, please.
I have a question.
Yeah.
For like the anthrax and smallpox, like, do we have to know, the symptoms and incubation period and transmission and all that for?
No. Those slides are in there just kind of as an information for you.
Okay.
What's important for you to know when it comes to the different types of bioterrorist agents, and those were all class A. The ones that are more specific, the smallpox, the anthrax plague, is the nursing measures. It's really, we're looking for what is the nurse's role, and nursing measures that you would take if you had someone who was presented with those symptoms.
Thank you.
You're welcome. Okay. So
I'm sorry, I have a question.
Yeah, please.
Do we need to know about the history of that terrorism, like bioterrorism attack that have like that goes to that like World War I and stuff like that, or no?
No, you don't need to know the specific history, but why do I talk to you about history? Why is that important? Do you know, Sony?
We learn from it.
You learn from it, right? So so looking at that history that was on the slides, tell me, what have we learned?
Preparedness.
Preparedness, okay. Can you be a little more specific in terms of any particular disaster that helped us, pushed us forward?
You mentioned after 9/11, the Department of Natural Health was created. And
Department of what?
Did you say natural health?
No, Homeland Security.
Homeland Security, that's what it was, sorry.
Homeland Security.
And we now know, I mean, like, first come interventions as far as like for bioterrorism, like antibiotics starting, giving the vaccine and stuff like that, just to nip it in the butt if and when it happens.
Yeah. Any other thoughts on the history and why history is so important?
We use that to develop our plans for the preparedness.
Okay, helps us to develop our plan for the preparedness. Okay, good.
Know what to expect and how to respond in certain situations.
Do you think we've always learned? How are we doing with some of our history and our lessons learned? What do you think? Think about the pandemic of, well, we had 3 major pandemics, and I know we talked about this primarily in communicable diseases, but a type of terrorism is biologic, right? And that can cause the spread of disease because it's a biological agent. So in a way, it is communicable without respect. But think about the history of influenza pandemics in this country, and how, and then our response to the pandemic. This pandemic, is this an influenza pandemic, the COVID-19? No. What kind of pandemic is, what is the agent causing COVID-19? Coronavirus, right. So it's a different type of infectious agent, but it's still a pandemic. So when something's pandemic, it's global, correct? So it affects every nation in the world. But some of our response to COVID-19, if we had followed the lessons of particularly the Spanish flu pandemic, which was in 1918, it may have help. And again, politics is very much a part of this. But, you know, if we had put into restrictive measures earlier and requiring mask wearing, et cetera, and had it and not stopped it so quickly, maybe we would have had less deaths than we've had so far. So we don't always learn from history, sadly. You know, the point of history is to learn from it, but, you know, it doesn't always work quite that way, but that is the reason we talk about history, is just so you can see that this is nothing new, what's going on in terms of disasters. If anything, disasters right now are occurring more frequently. Do we know why we're having more frequent disasters? There's types, well, let me ask you this. So there's two types of disasters, right? We have man-made and we have natural disasters. All right. So our natural disasters, are they happening more frequently, do you think, than they used to? Are we having more natural disasters than we used to? You're shaking your head, Kirsten.
I'm saying yes because there's more people than there used to be. I mean, the population's growing. What we're doing to rainforests, and I mean, there's just a lot of things. The weather, global warming. So there's a lot of different factors that are part of it. But yeah, I would definitely say it's part of its population.
Yeah, yeah, that's true. So that's a good point. Anybody else? So yeah, climate change seems to be having a tremendous effect on the amount of disasters and the severity of the disasters. Yes, we've always had hurricanes, we've always had tornadoes and other disasters, but it's oftentimes tied right into our how we treat the environment. And population does, you know, the increase in population means there's more utilization of resources that can contribute to overall global warming, which then adds to the disasters. But we have, so those are natural disasters, but think about it in this term. Some of those natural disasters are almost man-made. When you think about environmental contributions towards natural disasters, some of those are man-made. We're building on areas that should be preserved, you know, along the coastlines. So the closer, you know, the more and more houses that go up, it's sort of the idea of you know, you're destroying the natural environment, which is there for the ecosystems, for things to work the way they're supposed to. So if you keep building, so it's like a lot of it is man-made, not just natural, but man-made contributes towards those natural disasters. So so that is true. So the other type of disaster is the man-made disasters. And what's so that would be your terrorism, right? So we have different types of terrorist attacks. We have chemical and biologic attacks. There's also terrorism that occurs, you know, on things like 9/11, where they crash planes into buildings, but oftentimes the type of terrorist attacks that are used are biologic or chemical. And so what is the nurse's role in disasters, whether they're man-made or natural? What, can you talk to me a little bit about what is some of the nurses' role in those disaster incidences? Anybody?
Prioritizing care.
Yeah, prioritizing like who needs who we help first.
Okay, so prioritizing. So two of you said prioritizing, right? So, but before you can even prioritize, what do you have to do?
Know your scope of practice.
Know your scope of practice. Absolutely. You cannot do things even in disaster unless it's within your standards and scope of practice. So knowing your scope of practice, recognizing that a disaster has occurred. So before you can even begin to prioritize, you have to realize something big is going on here. And so recognizing that something has occurred so that, and this goes to one of the last slides, the role of the nurse in that long-term care facility, right? There were the 4 options. What was what is the primary role of the nurse who's in charge? It's to
Call the off-duty staff.
activate the emergency response, right? Is that what you said? I can't tell who said.
Yeah, I said to call your off-duty staff and have them come in.
Well, but that anybody can make that call. Anybody can make the call to bring other people in. But this is the nursing director of a long-term care facility, who is the incident commander. What is the priority action for the incident commander? Remember, I talked to you about what the incident command system is, right? Okay, so we're still talking about the nurse's role, but in this case, the nurse is now the one who's in charge of is considered the incident commander. What does the incident commander have to do? In that question, which was slide 55, calling the off-duty staff, yeah, they could, but anybody can make that call. Taking inventory of available supplies, that should have been done a long time ago. You should always, as an incident commander, know what your supply availability is. 3 is activate the disaster management plan process according to the plan. That's the answer. Once you activate the disaster management plan, then and that needs to happen right away so that you can get other personnel in there to help you. Because you are the nurse, and yes, you have to prioritize and you have to recognize what's going on and you have to work within the scope of your practice. The incident commander is going to activate the disaster response so you can get others there. But how's the incident commander going to even know? So if you're the nurse and you're the first one on the scene, or you recognize something happening that seems like it might be an impending disaster, you need to communicate, right? Communication, getting that call out there to the incident commander, there's something going on here. Okay, what else is a nurse's role? Any other thoughts on that? How about your own self-care? You as the nurse have to protect yourself. You have to protect everyone. You have to protect yourself. So self-care, self-protection, having your own personal plan for your family, for yourself and your families. Okay, so the nurses also everybody should have a plan, but we're talking about the nurse here. And then of course, helping others. That's the role of the nurse in a disaster. Okay. What's the difference between a disaster and an emergency?
An emergency is more routine and you have resources available to, treat it. However, a natural disaster, it's a mass casualty situation and you have to call.
I didn't hear the last part, but yeah, it's a mass casualty incident. So when it's mass casualty, how many victims?
Over 100.
Right.
And you'll need outside help. like FEMA or other resources.
Right. So, yes, ultimately FEMA and other outside agencies will come in to help. There's both on the federal level as well as the state and local level. There are agencies that can be activated to help. So one of them would be the National Guard. In the state of Maryland, we don't have in terms of natural disasters, probably the worst thing that can happen here is a really bad blizzard. We also are vulnerable to hurricanes, but usually with flooding more than the winds that cause the destruction like they do along the Gulf Coast and eastern seaboard cities. But oftentimes when we have a blizzard and after it starts, then the governor can declare an emergency and activate the National Guard. So, so yeah, you do have government agencies that do get involved, or Red Cross, FEMA. They're all set up to respond to some of these disasters. Okay. So when we have a disaster, which is a mass casualty incident, and we have which includes, the definition is over 100 people have been victimized by this disaster. It changes things a little bit, doesn't it? So what are some of the differences in how we respond to a disaster versus an emergency?
Reverse triage.
Okay, so talk to me about reverse triage.
You're going to tag your patients based on green tag if they're walking wounded, yellow tag if they need emergency medical help but it's not imminent, red tag is imminent help, and then black tag they're already either deceased or you would need way too many resources to keep them alive.
Exactly. So under normal circumstances, some of those patients had the most life-threatening injuries, could potentially survive. Under normal triage, we would attend to them first. But oftentimes those people that are so critically injured or sick require too many resources. So in a disaster, when we're using reverse triage, or that sometimes it's referred to as disaster triage, the amount of resources, both people and equipment, for that person to survive would overwhelm the system. And we have to do, what's the adage? The greatest good for the greatest number of people. So somebody who under normal circumstances we might be able to save, we would have to determine in reverse triage that they're going to take up too much time, resources, both people and equipment. And so we would make them comfortable, but move on and attend to those that have a red tag. So they have very life-threatening injuries, but we can treat them without overwhelming the system by the amount of resources that we have to use. Does that make sense? Do you understand the difference between them? Okay. So,
I'm sorry, I have a question regarding
yeah, sure, absolutely, Ari.
This happens at like ground zero, right? This happens at like the center of whatever disaster is going on, not necessarily like the emergency room or the bay of the hospital.
Correct.
Okay.
Yeah. Generally, it's in the field that it would happen. So let's say there's a mass shooting. You're going to attend to those victims right there at the place where the shootings occur, or they quickly get them it could actually occur either place, because a lot of times if the ambulances get there quick enough, they can transport victims to the hospital. But again, it is, so it could be either, but generally speaking, it is at the place where it happens. Okay. And it seems like, well, once you get to the hospital, there's plenty of resources, but not if you've got hundreds of victims coming in, you know, and typically a mass shooting is not considered a mass casualty incident. So actually now that I'm thinking it through, mass shootings, I've never been, thank God. It's bad enough that there's 10 or 15 people that are affected, but that's not considered reverse triage with a mass shooting incident. Okay, it's horrible that it happens, but you can get the ambulance there and get them to the hospital and they get the treatment. Even if they have such severe life-threatening injuries, we could still attend to them. But we're talking about something like, mostly it would be a natural disaster where you have over 100 victims, you know. Okay. What about vulnerable populations? Who are some of the populations that we have to be concerned about, especially when we know we'll talk about an impend. So we have natural disasters. Typically, we know that they're happening. We know that they're coming. We have time to prepare, right? It's when the governors get on and they start telling the people in their state to prepare. There's a storm coming. Tornadoes are probably the least predictive of the natural disasters because they can happen so quickly, but they still have alert systems and it saves lives. But who are some of the vulnerable populations that we have to be most concerned about, and what do we need to do? So talk to me about some of those vulnerable populations.
ESL, so people non-English speaking.
Okay, so someone doesn't speak English, what would be what's the concern there?
They don't get any of the information. If it's only going out in English, they won't understand.
Okay. So how do we reach them?
Interpreters.
Okay. All right. So there may be community nurses that might go out in that area, because usually like with a hurricane, we know a couple days in advance that something's happening. So it's a community outreach type thing for someone who doesn't speak English, or again, part of the role of the public health department is to recognize areas in their cities or their towns, their state, that has a large percent of non-English speaking population, so that they can reach them and give them the information. Okay, so that's one type. What are some other populations that are at greater risk in a disaster?
The homeless.
Homeless. Oh my gosh, yes. So how do we reach them? Same idea, right, Ari? Think about it.
Yeah.
Yeah.
I mean, yeah.
So what happens with the homeless population when there's an impending disaster?
Maybe they get moved to shelters.
Shelters, yeah. If they're willing to go. And they're not always willing to go, but that's a chance. Then somebody has that right to make the decision. But yeah, so it would be moving these folks to shelters out of harm's way, or moving them at least, 50, 100 miles out of the area. But then you have to get transportation to move this population of people out of harm's way. How about the elderly? Do you think they're vulnerable when it comes to storms? What do you think, Nakia? I see you shaking your head.
Yes, because it depends on what kind of storm or whatever we're having. A lot of them don't have like air conditioning or I don't know. They just can't. They don't have help. Some of them are living alone, things like that.
Living alone, maybe on oxygen. What about those that are on oxygen and there's a storm coming and there's a really good high chance that the electric's going to be taken down because of the storm. So making sure there's backups for them, or getting them out of the area, moving people to shelters, or finding, talking to them about having an emergency plan. So this could be a role of a community public health nurse, is to ensure that vulnerable populations have a plan in place even before a possible storm is coming. So that if there is an announcement a storm is coming, they have a plan to get out of harm's way. Some people won't leave their home, they just won't. So making sure that they have enough medicine, that they have backup oxygen if they're on oxygen, do they have a generator? People that have mobility issues are considered vulnerable. How are they going to get out of the area? So any kind of mobility issues, any kind of sight or hearing issues put somebody at a greater risk. So you have to think about the role of the nurse when it comes to reaching vulnerable populations as a disaster is impending or unfolding. I said some, particularly terrorist type disasters, we don't know they're coming. We don't know that's what's going to happen. So we have to have plans in place ahead of time and make sure that we reach anybody who is in harm's way, or that they have a plan to get to a safe place. All right, so that's very, very important. So having a plan. So when somebody, so again, talking about the nurse's role here, the nurse's role in a biologic disaster, okay? So we'll consider this a type of terrorist attack. It could be release of some type of a gas agent, which has happened in certain countries where the government is actually genocide on their own people, using different chemical agents. But then again, there's the biologic agents. So what is important in terms of the nurse's response? Somebody who's been exposed, let's start with the chemical. What would be a nurse's response? What do you need to do? Somebody who's, I'm sorry?
Decontamination.
Decontamination. So how do we decontaminate somebody? Showers.
Wash them.
Yeah. So making sure that you protect those around, that so that, so you don't want this, so if they come and they've been exposed to a chemical agent, the first thing you need to do is decontaminate, but you also have to protect those around in the environment as well. But decontamination is essential. You have to get them in a shower, wash with soap and water, or just water even is good, just to get the chemical off. What about a blast injury? So from a bomb. So think about bombs. Different types of bombs. An example was the Boston Marathon. Those were man-made dirty bombs, what they call dirty bombs, and they have all kinds of shrapnel and different things within the bomb that they make that's set to explode and cause mass casualties and damage, and that's what happened in the Boston Marathon. But oftentimes those injuries can also, different types of bombs can cause a blast injury. Okay, so make sure you know about that, understand about blast injuries. Biological exposures. Again, I mentioned it when somebody asked me in the very, very beginning, just know what the nurse's role is. If you are working in the emergency room, and a lot of people start to present of all different ages with the same type of symptoms. A large numbers start to arrive. That would be your first clue that something's going on, and so reporting it, of course, and then depending on what the symptoms are, get the medications, the vaccines, whatever it is that you need to have available to start administering right away. Okay. Biologic terrorism can occur so I had, years ago, I worked with a nurse who was an infection control nurse, and I'd gone to a conference. And when she came back, she shared with us what she had learned, which was that, even a thimbleful, like the smallest, tiniest, minute amount of agent could be put into the HVAC system in a subway or in a building, and that would be released and could have just mass casualty from the release of that biologic agent, just in using the HVAC system. So we have to be aware of and know how and be prepared how to deal with this. And so just be aware of that as well. So the levels of disaster management. There's 4 levels that I talked about. Mitigation, preparedness, response, and recovery. Make sure you understand about them. Mitigation is what? Making sure it doesn't happen in the first place, right? Okay. Preparedness, having everything in place that you need ahead of time. So the Incident Command Center has the 4 different components. Let me find that paper. Anyway, under the Incident Command, so you need to understand the 4, here it is. 4 different organization under the Incident Command, which are operations, logistics, planning, and administration and finance. So under Incident Command, and the hospitals all have their own Incident Command Center. That means that they have the operations, the strategies, the tactics, how to recognize and respond to accomplish whatever goals are set by the commander. The logistics, how are we going to move people? How are we going to move supplies, equipment? Okay. Planning, what support activities are needed, coordination, information, and then of course finance. This doesn't happen for free. So the under preparedness with the levels of disaster management, you have to, under the Incident Command, you have those different levels to help you to be prepared for the disaster. Okay. How do we respond to the disaster? And again, that's through practice. You should be involved in emergency preparedness. They do simulations. A lot of the hospitals, they'll do mass casualty incident situations where all the staff are particularly those who work in like emergency room and all, they have these practices, they're drills, and they practice them to make sure that everybody is ready to respond in the event of a disaster. And then finally, recovery. And I talked to you about the stages of recovery, and the whole stages. And remember, there's the whole idea of the honeymoon phase, etc. So recovery includes, it's like a quality improvement type situation. You had a disaster, you look at what your response was, and then what can we do to improve our response? And that's exactly what happened after 9/11 with the establishment of Homeland Security. It was recognized that we weren't prepared enough, even though there was chatter, because there's always somebody looking through those kinds of things and being aware of it. Nobody really was ready for something like that to happen. Here comes Angela. So they developed the Homeland Security as a very specific department to look at this type of terrorism on our homeland. And of course, now we're seeing, and the Department of Justice is looking at more of domestic terrorism, which is pretty much what happened on January 6th with the insurrection at the Capitol. That was domestic terrorism. The Oklahoma City bombing was domestic terrorism, which happened I believe it was in the 90s, but that was domestic terrorism. So these different departments look at this very specifically. We're looking at terrorism on our own country. And sometimes that terrorism is our own people causing terrorism, because, you know, people have different political views, etc. So there's all kinds of, and that's not what this class is about to talk about, why it happens. We just know that it does, and what is the nurse's role in responding to disasters. So let's see. Can you think of any? So the most recent, I know in my lecture, I talked about some of the fires that were occurring. We have terrible wildfires. They're not happening as much during the winter months as they are in the other 3 months of the year. So, but what happens in the winter, the most recent really severe winter disaster was in Texas. What happened in Texas? They had a terrible cold snap and a blizzard that affected their whole electric grid. So people went for days without any electricity, and so they were cold, and they didn't, you know, it was just a terrible, terrible disaster that happened. So, and again, a lot of this stuff sadly does occur because of political reasons. Like in Texas, they knew that there was a problem with the power grid 10 years earlier when they had a similar storm, and yet they did nothing to change it. Sometimes it's financial, sometimes it's political, but it happened, and we didn't learn from that history of what had happened in Texas 10 years sooner. They did not learn. So, you know, community outreach, community effort, community people working together, no matter what your political views are, is the only way we're going to get through some of these disasters, and maybe hopefully stop some of them from continue to occur in such intensity. But we have to recognize that if we just keep going just exactly how we are, it won't improve. It will get worse. So we have to just think about those things. So we can talk about COVID-19. Let's just talk very briefly about that as a disaster. So we're now over a year into this pandemic. There has been a tremendous financial toll. Obviously, the worst toll is the number of people that have died as a result of COVID-19. Over 550,000 people here in the United States of America have died from COVID. Many of those people are vulnerable populations. You guys hear this word, but do you recognize what's happened? Do you see how, no matter what the disaster, how it affects certain populations more than others? And so with COVID-19, people of color, people with multiple chronic diseases, so comorbidities, they're at a much higher risk for either getting COVID-19 and or dying from COVID-19. So that's the disease. Then we talk about the testing for COVID-19 and how many people had access to testing. Again, were there mobile outreach in areas where people couldn't get to a test? What about rural areas where they don't have that? What about now vaccines? We're talking about vaccines. Again, who's getting those? Who got those vaccines first? Yes, they did it by like those 75 and older, then 65 and older, people that are frontline healthcare workers. You know, so they broke it down to who was eligible first. And not everybody is taking the vaccine. They don't necessarily want it. So community nurses need to educate why vaccines work. How do we stop this pandemic? By stopping the chain of infection. And the only way you can do that is by vaccinating people and getting to herd immunity. So people without transportation, people that speak a second, that don't speak English as their primary language, people that live in rural areas, they may not get access to that vaccine the way others might. And so there's a discrepancy. It's not equal how vaccines have been distributed. So then in terms of other disaster response to pandemic is the emotional and mental health toll that this pandemic has taken on people. Whether because someone you know has died from the disease or gotten the disease and was very, very sick. Emotional toll because of loss of a job, loss of income. You know, everything that was happening in this country in 2020, besides pandemic, you know, we had the Black Lives Matter movement, which needed to happen after George Floyd was killed. But again, the turmoil and the emotional stress that caused for so many people, no matter what color your skin is, the emotional turmoil of where our country was extremely devastating. And, you know, I think we're on a road towards recovery, but I think we have an incredibly long way to go. So there's the whole emotional toll to both the pandemic itself and then some of the other events that were happening at the same time just compounded the emotional toll. Just for you guys, think about it. You started nursing school. You didn't expect to be doing Zoom classes for 3 semesters, but here we are in your 3rd semester and you're still on Zoom. Hopefully your 4th semester, you'll get to be face-to-face. But we've all had to make tremendous amount of adjustments. So that again is part of that emotional or part of that disaster. Sort of, I just wanted to break it down using the COVID-19 as the example and where we are. So we're not in recovery yet. We still have a long way to go. But we lacked leadership, I think, in terms of a centrally located, this is what we need to do as a nation. And right now, states are still doing whatever the heck they want. You know, so some states never really required masks. Some of them have dropped it altogether now. So it becomes your own personal responsibility to how you want to live your life. Is, you know, people believe in their freedoms. Well, yeah, but again, remember the greatest good for the greatest number of people sometimes means that you give up some of that personal freedom for the betterment of society and mankind. Right now, India is in the midst of a tremendous, tremendous disaster in terms of COVID-19 and the variants that are now spreading rapidly. And so I saw yesterday the United States is sending PPE and some of the other needed supplies to help them, oxygen, nurses, doctors, whatever, to help combat this. Why do we care what happens in India? Why do we care that we give enough vaccines to India? Why is that important?
Because people travel, so they migrate. They're gonna go to India and bring it back and things like that.
Exactly. Because we live in a global world. People travel, and especially now that people are getting vaccinated, the amount of people in airplanes has gone up, the amount of people traveling. And that's a global travel too. So, you know, if we can, so what's important is that we get vaccines, not just we, the United States, we're not responsible for everybody, but as a country and as a people, if we can be part of the solution, which is getting the world vaccinated, not just people in the United States, but the world, and being part of the World Health Organization, which we are now back as members of, will, you know, the countries like our country and European countries, we have the economics, we have the supply, we have the ability to help other countries that are more third world or need help economically and every other way. So we have to do that as part of the global response, because that's the only way that it will ever really fully end, is through global response to the pandemic and helping countries that aren't able, that don't have the resources. So the countries that have the resources help the countries that don't, so that we all ultimately become free of this pandemic. So so that's, again, it's a disaster, it's a global disaster, and how we respond as a world community, you know, will stop this disaster from continuing. And it's the same with climate change. You know, that's why we're back in the what is it, the Paris Climate Treaty, because if we need everybody to agree that we have a problem and how to fix it. And without doing it as a global response, it doesn't, you know, it helps, but it doesn't. We need to do it globally. That's my point. So that's really important stuff for you guys to understand. And I think those are the primary areas that I wanted to touch on today. Is there any other questions, thoughts, comments about disaster nursing and understanding it from a global perspective? So, well, okay. So those, like I said, that was the main areas that I wanted to touch on with you. And so now what we'll do is we will have your groups present their your your windshield surveys. I also wanted to let you know I have gone through the case studies, those of you that have already admitted or submitted, excuse me, submitted your George Palo and Butch Sampson case studies. There's a couple, and I left notes if they were incomplete or you need to, yeah. So that's that. I hope, and that hopefully that will help you guys when you think about discharge planning and case management and home health, and I'll help you with your studying also. Okay, so any questions, any comments? You guys hanging in there? Okay, all right. So who wants to go first with the windshield survey presentation? So I just tell you, should we just go down the line then? We got 3 groups. Group 1 want to go first? Yeah. Group 1, how about you guys go first? Okay, that would be Karen, Antoinette, Ophelia, Dana, and Christine.
Okay.
Can you share your screen?
One moment.
Certainly.
Okay. You guys can help me out.
Okay, so whoever's in this group, help out Dana.
So we chose to do White Marsh instead of the area of our clinical site just because we figured everyone was going to do by the clinical site.
Okay.
Goodness. So based on the US Census data, the population is about 9,500. The median age is about 40. And then the majority is white, and then Black, followed by Asian and Hispanic. This kind of supports what we saw during our windshield survey. We noticed it was mostly white people out around, middle age. There's some younger people too that were out and about, walking around. So the people, they were dressed casually or in healthcare attire or business attire. So it seemed like a lot of people were out walking either to or from work, because there's a lot of healthcare businesses in the area, or just out walking their dogs, jogging, riding bikes. And it seemed like the people were mostly in the working middle class.
Okay. What's the matter? You okay?
Have a group.
I know. Come on, guys, help out your teammate here.
So the surrounding areas are Perry Hall, Rosedale, Kearney, and Parkville. It provides easy access to Towson and the city of Baltimore via Interstate 95 and 695. And it's sort of, I guess the unofficial boundaries, it seems to be sort of boxed in between I-695, Route 1, Route 40, and then Gunpowder Falls. So I guess that's sort of man-made boundaries as well as natural with Gunpowder Falls.
So for the places we realized, like the medical centers nearby, obviously Franklin Square Medical Center is located right near White Marsh. And then there's also the Johns Hopkins Center at White Marsh. There's a Kaiser Permanente Center. And then there's also just a lot of little independent doctor's offices and other healthcare providers in the area. There's multiple patient firsts, like urgent cares. There's different specialist offices from MedStar. There's multiple office locations. And then We also noticed there's a few different mental health offices and obviously dentists too. So this area is pretty densely populated with healthcare options. So it's not like yeah, that was like a good thing. There's plenty
A
of
lot of
options.
access.
Yeah, easily accessible.
Mhm.
And they all were very accessible via public transportation, or you could even walk to them. There's sidewalks that kind of connect things. So a lot of them are close by to like bus stops and things like that. So it's easy to access healthcare in this area. Major industries in White Marsh really are retail and restaurants. Like there's the mall, the avenue, and just other like big shopping centers. And it seems like a lot of the industry in White Marsh is just retail and restaurants. Again, there's also all of those medical offices. So there's a lot of businesses in the area. There's an Amazon fulfillment center, and by the mall, there's like, yeah, that's like where uh, the distribution center is, I think. There's a lot of blue collar and industrial workforce. And then hospitality, we said just because there's some hotels and things in the area. And so that's also just another big area
Mhm.
of industry and where people have their jobs. And then we noticed when we were driving around, a lot of the living situations are townhomes or apartment complexes. There's not as many single family homes, but there are developments of that. And everything's in the housing is in good standing. Um, seems pretty, it's like a safe area to live in. It's not like there's any abandoned.
Yeah, there were no dilapidated properties, and everything looked well kept and
Yeah.
inhabited.
Yeah, everything is up to date and well kept. And even the older buildings seem to be remodeled and just kept up with. Nothing's like falling apart or anything like that. But it did seem that the majority of the people who live in this area are in either townhomes or apartment complexes versus standalone single family homes.
So there were the main schools that served the people in the area were Perry Hall Elementary, Middle, and High School. And then there was also Joppa View Elementary and Chapel Hill Elementary, and then the Goddard School of White Marsh, and then of course CCBC Essex. So there are a lot of options for school. I mean, they're mostly public. So it kind of depends on your zip code as to where your child's gonna go to school. But those were the main ones. And then religious, like places of worship, it was mainly churches. There wasn't really a lot of diversity. Didn't see a lot of, I didn't see any mosques or synagogues. So the churches, a lot of them were non-denominational, and then there were Methodist and Baptist.
Yeah, I agree with that observation. There wasn't a whole lot of, like, I don't think I even saw a single Catholic church in the area. It was mostly, yeah, the non-denominational Methodist and Baptist, and but there wasn't a whole lot of options for the churches either. And then we'd like to note that for school-wise, we have CCBC here, but the location is still very easy to access, like Towson, Hopkins, and University of Maryland, if you had to. So grocery store wise, there's mostly large chains. Like there's not any little corner stores or anything. So it's mostly like Giant, Weiss, Target, Walmart, things like that. There's a lot of pharmacy options. We saw CVS, Walgreens. There's a Rite Aid closer to Perry Hall. So there's a lot of options there as well. And then the fire and police station are present. You could see a lot of police just kind of patrolling the area during the day. So makes you feel like it's a safe area.
Mhm.
And then yeah, there's a lot of green space. So you have Honey Go Run Park, and there's plenty of sidewalks and just areas that people can walk and not be worrying about like getting hit by cars or things like that. It's very um like exercise friendly too.
Like pedestrian friendly and whatnot.
Yeah. And then driving around, honestly, I got stuck behind the Maryland the public buses a lot, so you could tell that a lot of people are using them. There's plenty of bus stops and bus routes that go to both the hospitals and medical centers as well as the stores and shopping centers. So if you don't have a car, you could still get around and access everything that you need. Um, it seemed like the people that were waiting for buses were more of like a working class. Like you could tell a lot of people were either in scrubs or in business attire. So you could kind of see that. And then Lyft and Uber are both accessible in this area. So if you don't have a car and you still need to get somewhere, those are always options as well. And then there's also the big park and ride Greyhound bus and Mega bus that can take you to New York or DC for those larger commutes. So people that don't necessarily work in Baltimore, but they still, or they do want to just travel to one of those other big cities for business or other things, it's easy to access.
Okay.
So some of the areas of concern that we did notice really isn't a lot. It's a very safe area and very accessible. But looking at some research on like housing costs, just to rent a 1 bedroom, the minimum you're gonna see is close to $1,000 a month, which that's hard to afford by yourself, especially with minimum wage. So you kind of have to have a decent income to live in this area. There's a Suboxone clinic that we saw, so that kind of indicates that there is a need for substance abuse and counseling in that area. We said air pollution just because of all of the industry and a lot of cars and buses driving around. There's a lack
It's a
of,
very densely like populated area as far as like there's a lot of traffic during certain times of the day because everybody's driving around. So, and then because there's a lot of people that walk, they're going to be exposed to the fumes and stuff that are given off by all of the cars.
yeah. And then spiritual health is very important to a lot of people. And it just seems like there's not a lot of close by options for churches, whether you are Catholic, Christian, or Muslim, Jewish. There's really a limited amount of churches in the area. It seems like you have to travel to get to the other denominations of churches. So
And people may be more inclined to move or to live where they can find that
Yeah.
spiritual community, so it doesn't really promote future diversity in the area.
Okay.
yeah. So that's
Okay.
as nurses, you want to support everybody's obviously psychosocial health, and you want to consider that some people really do follow religion closely, and that really plays a big part in their mental and spiritual health. So you just as nurses, we would want to try to connect people with resources so that they can still practice their religion even if they can't necessarily travel to the churches. And then lack of education options, we just said this because most of the schools in the area are public schools, and it's kind of, I know a lot of people like to send their kids to the private schools just for better education, and it just seems like there's none super close by. Like you would have to kind of travel out of the area, which is kind of inconvenient for parents and kids as well. So it's just something that we notice in the area.
Okay.
the strengths, I would say everything's conveniently located. Like there's no trouble accessing stores, restaurants. You have healthy food options, but you also have your, junk food and fast food options. But there is the option to access healthy food. Like we're not in a food desert or anything here. Um, so the businesses are also close together. So if you had to take a bus to get to a store or a medical center, you can still access other things closely. You wouldn't have to get onto another bus to get there. There's plenty of options for healthcare. So whatever your healthcare covers, whether it's MedStar or Kaiser Permanente or Hopkins, you're going to be able to access a physician in the area. Safety, it's definitely a safe area. I drove around in the afternoon and then again at night, and there's still people walking around and outside. So it doesn't seem like, when it gets dark, people have to run inside because it's still a safe area to be in.
And the police station is like right next to the mall.
Right.
And I think there were like 3 fire departments and the volunteer fire department in the area. So in the event that anything would happen, response could be quick.
Yeah, and just driving around, I passed a lot of police cars just patrolling. So at least you know that there is a presence and they're out there watching to ensure that the community is safe. Like I said, it's not a food desert. There's a lot of grocery store options and food options. So it's not like people are forced to only eat fast food. Like we have Giant Weiss, Target, and then there's also like Aldi and
Yeah, Aldi's.
so those are more affordable options too. And then there's also the other end of the spectrum where there's like the Mom's Organic Market. So if you did want to spend the extra money to get all organic food, you have that option too.
Yeah. Very good.
There's a lot of green space. And like I said, when we were driving around, there's so many people just jogging, riding bikes, walking their dogs. So it seems like it's very like encouraging for just to keep people active and places to go other than just spending time in their house all the time. And then ethnically, everything seemed integrated. It's not like there's like a Black neighborhood, a white neighborhood, and it's all separate. Everything's integrated, and it seems like the different races can spend time together and cooperate. So.
And I noticed more interracial couples walking around than I guess in other areas that I've been in. So
Okay. All right.
And then we just said like these are just some social determinants, but I kind of already touched on these in both the strengths and the weaknesses.
Okay.
So the pollution is like a big concern, just for quality of health for people with asthma and respiratory problems, things like that. The education access, like I said, was kind of both an issue, and it's okay because there are a lot of schools in the area, but if you want to have the option to go to private schools versus public schools, you have to travel a little farther. But again, the location of White Marsh is very easy to like get on any of the highways to go wherever you need to go. So, and there's a lot of public transportation, so it's not the biggest thing. But yeah.
Okay. Very nicely done. Very good.
Thank you.
You covered everything. And, you were able to identify if there were the areas of concern. And so how we address some of those would be what? Through different types of community forums, right? If there were certain areas, but you had to data, et cetera. But you definitely, very, very good job. Very nice.
Thank you.
Thank you. Okay, group 2.
Okay, that's us.
Okay,
Right?
all right.
All right, I'll go ahead and share my screen.
Okay.
All right. Okay, so we did the Towson and Rogers. So we went past our clinical site at St. Joe's and we went a little bit further south towards like Rogers Forge area. We wanted to get a mix of like close to the university and then a little bit more like residential living. So we get like best of both worlds. So
Okay.
that was where we all kind of like formed a line in our cars and we just drove around the area and followed each other. So that was our I guess
Your
method of
approach. I like it. Okay.
Okay. So in the area, we identified the strengths and the weaknesses. So the risks of living in this area is that it's quite busy. So it's obviously close to Towson University, which is a Division I school. And you have lots of student traffic and sporting events. And things were a little, from my observations for a Thursday afternoon when we went, there was not as much foot traffic as you usually would see in the area, given that COVID, the pandemic. So a lot of people opted to do remote learning for Towson University. A lot of the foot traffic, it wasn't as crowded, and that in the sense that there weren't as many students as there normally would be, but definitely when there are gathering or sporting events, there still is a large number of people gathering. So another risk is that it's close to Towson Town Center, which is a very popular shopping center. And they have a lot of luxury and designer stores. So that draws the attention from more than just your local people. It draws more crowds from further away to go shopping at those stores. Definitely some popular restaurants nearby that draws crowds. And there's risks for traffic, pollution, littering, and crime. Another thing that we saw lots of were construction in the area, all the way from the town center down to the residential areas, which is a cause for concern as far as like being a risky job, traffic, and in the sense that, you're working with heavy machinery and just car traffic, the chance of being hit or clipped by cars, noise disturbances for residents, and the loss of sidewalks for pedestrians, and there's less room for street traffic. And the benefits of the neighborhood is that it's in close proximity to hospitals and healthcare. So there's GBMC, St. Joseph's, primary care physician offices, and specialist services within a 2-mile radius of the zip code. And access to essential items such as food. So there were plenty of grocery stores. There was a Whole Foods and another organic supermarket, and then a Giant not too far away from where we were. And then plenty of education opportunities, both public, private, and collegiate. There's Towson University, Goucher College, St. Pius X Elementary School, which I'm assuming is private, Stoneleigh Elementary, Dumbarton Middle School, and Towson High School. So you have different types of education, different levels. And there were plenty of, there were a few accesses to homeless shelters and resources for those who may need it. There was the Assistance Center of Towson Churches, and Prologue Incorporated. So those are both resources that if you need help paying your bills or you need canned food items or non-perishables, they do have those available for those in need. And then they also had access to addiction resources. And the Maryland Addiction Recovery Center is located right there in Towson. So there's that available to those who may need it. All right, anybody else in my group want to hop in? If not, that's fine. Okay. All right, so, and just some examples, I had my phone on my dash, so I was able to record our drive to get little screenshots here and there. And so this was some of the construction that we actually saw. And this was all towards, this was a little bit more south in the residential area. So this was all within a matter of like a mile of driving. And this is just the number of construction. So we have, obviously we had to go over the left lane. So there's obstruction of street traffic on several instances. And then the crosswalks and the sidewalks were completely blocked off for pedestrians. So that means they either had to go onto someone's property or come into the street, which is a risk for accidents. And same here with the obstruction of the road. And for Towson's crime rate statistics, I found these pretty interesting. The chance that a person will become a victim of any violent crime in Towson, such as armed robbery, aggravated assault, or rape, murder, is 1 in 236. And then for property or violent crimes, it was 1 in 40. So this is a matter of if you were a resident in the area and some kind of vandalism was done to your property, it was 1 in 40. So that was an interesting statistic that I found. And then relative to Maryland, Towson has a crime rate that is higher than 80% of the state's cities and towns of all sizes. So, I mean, like you're taking every little city and county into consideration, but still greater than 80% is it's pretty high.
Yeah. Why do you think that is?
I honestly think it is a matter of the college being local and the crowd that it draws and just disturbances in the area. And believe me, I've been a witness to, I've seen people post about vandals in the area, just college students just doing bad things in the area. So I think that statistic, but as far as like the property and the residential vandalism is definitely, I think, attributed to the college in the area, because a lot of students live and rent these houses in the back. So and they, if your neighbors to a crazy college group, then more than likely it's going to kind of maybe go a little bit over the property line a little bit and cause some issues. Okay, so how can we improve the health of the Towson community? Does anyone in my group want to talk, or I don't mind talking? Okay.
I can. So for primary, we said vaccination clinics, smoking education, STD education, just because some of the population is college students. So we feel like that is important. Personal hygiene education, communicable disease, and teenage alcohol, drugs, and of abuse education, just targeting those, clients that are of the younger population. Secondary, we did say, because a lot of the homes that we saw were older, we thought that lead screenings would be important. And then then we also said the BMI and obesity screenings, and mental health screenings also for, everybody in the population, but mostly targeting younger kids, teenage and college years. Tertiary, we said exercise program, rehab, nutrition counseling, support groups, chronic disease management, so like diabetes, high cholesterol, CHF, renal disease, and COPD, targeting all those populations.
And to add on to that, I said for tertiary, for the tertiary's prevention, for the chronic disease management, definitely you can almost make it a primary, just because there are so many specialist offices and PCP offices. You could definitely bring attention to those and point the direction of patients towards those management options. So definitely, because there are plenty right around right where Joppa meets Towson. There's just a whole lot of primary care. Just those office buildings are just full of different specialist offices. Okay. All right. And for this one, anybody want to take a shot? All right, I guess I'll go. For the social determinants of health, we said that the lack of public safety, just because the area, like I said, was of a higher crime rate. And so you have the exposure to crime, violence, and social disorder, which is obviously it's the moderate to high crime rate. And there was the presence of trash, and we related that to the high population in the area. And in a 4.6 mile radius, there's a population of 32,000 individuals. And we said the lack of cooperation from underage drinking individuals and the lack of community-based resources. There was a lack of public parks and recreation and these zip codes. There was a severe lack of green space. And when we were driving, obviously besides private property, we saw one public pool, but it looked like it was meant for maybe those people that were living there. It didn't look like it was public, like to the general public. And what I found the most interesting is after we drove around, I came back, did a little bit of research. They considered the circle, the infamous Towson Circle, that little green patch in the middle, they considered that a park. So I think that was interesting. I guess they wanted to slap a label on it because I think they know that they're like lacking in that department. So they wanted to call that Towson Town Circle a park because there's a patch of grass on top of it. So, and then the lack of bike and bus lanes due to crowded streets and construction. There were so many obstructions of the bike lanes and the bus lanes because of construction, coned off, trying to alter traffic. And during our drive, I hate to admit this, but there was a pedestrian that just came out of literally nowhere. And because they were trying to navigate around construction, had to come into the main road on York Road. And I had to like swerve to try not to hit them. And they were just, pedestrian right away, but they were completely out of nowhere. So I can't imagine that I'm not the only person that's happened to. So I feel like that's a big safety risk, is the redirection of traffic, of foot traffic. And obviously pollution and litter, people polluting and throwing trash out of their cars. And you can see on the sides, the buildup of just lots of garbage. And another contributor to that is because of the street cleaners. They can't get to those, the curbs, because there's either parking, construction, obstruction, and they can't clean the area properly because there's just so much crowdedness against those curbs that the trash just piles up endlessly. And lastly, our conclusion for the windshield survey was saying that by addressing all of these areas in our survey, we can focus on improving aspects of the community that will promote our primary goal of health promotion and disease prevention.
Okay. All right, very good. So you had mentioned the one area of concern was the housing. So what kind of housing is it mostly in that area? You said something about lead, potential in the older homes.
So the house is
third
down
slide.
towards
Fourth.
the third slide here. This one here?
Fourth.
No, I think
It was the
fourth.
one.
Yeah, gotcha. The lead screenings.
Yeah.
So the houses so there is definitely your list of college apartments right next to the university. But when you went a little bit more south towards Rogers Forge area, that's where you get to the more single 2-story family home, the residential area there. And some of the homes, I was doing some like real estate research, and some of them dated back to like the 40s, and because more towards the 40s. So we were thinking that just given a lot of the homes are being renovated right now, clearly with all the construction going on, just as a precaution for lead screenings, just because that was a popular material being used.
Okay, so but actually in the town of Towson, not so much Roger Forge, which is more sounds like residential as opposed to Towson, is a large part of it is the college community then. Is that what you would agree? Like what type of people did you see mainly? Like ages, ethnicity?
So when we came from coming up to St. Joe's, it was definitely a younger population, college students with backpacks on, walking in groups. And once we made our way towards the Rogers, a little bit southern Towson, it was definitely families. There were adults with children alongside them, riding their bikes, walking their dogs, going on runs. And there was a fine line where it kind of went from younger, college age students to more older adults, but it kind of mixed together just because along that strip, there's a lot of popular, like there's a Starbucks right there, and there's the Purell juice, which are popular spots for the college students right there to go get food and drinks.
Mhm.
So, but when we made that turn into the more residential area, it was strictly just like families walking around and doing yard work and stuff.
Interesting. Interesting. I wonder if on the grounds of the university, if there's areas for more green space, running or exercise, different.
Yeah, there
options.
wasn't. Yeah, we were talking about that because we were wondering if those spaces were public technically, but they're not like open to the general public. It's not like a
Right.
Baltimore County park or anything. It's meant for sports teams and for recreational use of the college students. But there were no like, hey mom, hey dad, let's go to the park. All right, let's go
Yeah.
down the street to the park. There were no places for like families to go and really do recreational activities.
Okay. All right. Very good. Nice job. Very good. Okay. Who's my third group? That would be Angela, Kirsten, Kelly, Bridget, Caroline, and Nakia.
Okay, can you see?
Mm-hmm.
All right. So we went to Govinstown to do our windshield survey, and we went as a
Can
whole
I
group.
ask where that is? I've never heard of Govinstown.
We were a little bit more adventurous and we went down towards the city of York Road.
Down York
So,
Road. Yeah, all on down York Road.
Okay. Oh, okay. Because I'm not originally from this area, so I've never actually have heard that term. So, okay. I just lost the picture of you guys, but go ahead.
Okay, so the people that we saw were mostly men, black men hanging out. They were on the streets. We went right after our clinical day, so around, I think it was 2, and then 2:30-ish, 3, and then one of our group went back at night to survey it again, and they found there were fewer people out during the night. I think we only saw 2 women total, and then correct me if I'm wrong, were there some kids in front of one of the schools, like they had
Coming
just
out
let
school.
out, I think, but there were not any like children walking up and down the street or women walking alone. No pets at all. Few birds did fly in front of our vehicle.
Not even what's
no feral animals, no animals.
interesting.
Yeah.
Okay.
There was not one person walking a dog or anything. There was
No,
nothing.
no dogs in the
There's a
yards. We
walking
went up and
dog.
down some side streets. No dogs in yards.
Okay.
So it was evidence of lower and working class. There was a ton of road work going on. Many small shops, ethnic cuisine and barbershops. There was funeral homes. A lot of police presence, cruisers parked, as well as driving up and down the street. Many police out on the corners. So the people that were out were hanging out and socializing. We saw more than one, carrying the liquor in the black plastic bag, drinking on the side of the street, like leaning on the buildings. So that would be the evidence of alcoholism and drug abuse. And then
Can I see some? There was a guy in the middle of the road screaming at car. It looked like he was trying to sell drugs to people driving past, but I don't know.
he was like pointing and screaming, like he
Yeah.
probably could have touched the car as we drove by.
Oh my gosh. Okay.
And the funny thing was at night, it seemed quite a bit calmer. Like there wasn't all of that going on. There wasn't as many people out. It was just like a couple groups hanging out in front of the house, but not really a lot going on at all at night.
Mm-hmm. Interesting. Huh. Okay.
Okay, so the place is located in Baltimore City, Govinstown, Maryland, 21212. 2 zip code. The human-made boundaries is North Belvedere Avenue, that's south, Woodburn Avenue, which is east. We had Midwood Avenue, which is west, and York Road. The major health institutions are it was one located either side of town. We got University of Maryland, St. Joseph, and we have Union Memorial in between that. They had access to multiple healthcare settings. There's no obvious threat to access. We had John Medical, we had Belvedere Health Center, Behavioral Health Center, and dental office. They were like older row homes and apartment style housing. 93% of homes occupied, 23% rental homes, some vacant boarded dwellings, and many in despair. No large industrial plants, large businesses, or factories. The social systems, the schools, we have Govans Elementary, Tunbridge Charter School, and in-home daycares. The community clinics, social agencies, there was one there, and they had with utilities. We had the dentist's office, as we said, and we had the 2 hospitals. So far as the stores, we have small grocery stores like CVS. We had the Advanced Auto Parts, the Dollar General, and many small businesses. So there is a food desert there. They have beauty supply, barbershops, clothing stores, liquor stores, and gas stations. So for churches, we saw one for Sunday school. Then we have Govans Presbyterian, Epiphany Church of Baltimore, Govan Boundary Parish, United Church of Love and Deliverance Miracle Center. No fire or police stations were seen. There is a large police presence on the street. They're out there with the guns, they're out there. We have accessible public transportation, buses, cabs, rental scooters, and they were well used by the residents. The road conditions were under construction, many potholes, uneven pavement, heavy traffic, and narrow roads.
So the
That's how I do it.
strengths, okay, I was to say the strengths, ease of access to public transportation, because we saw the buses and, taxis and the scooters. So there's plenty of public transportation there for people who don't drive, don't have cars. The police presence on the streets, we saw that as a strength, even though maybe they're there because they need it, but on the other hand, they're there. So at least, there were police cars basically parked up and down the streets, and like she said, there were police officers on the corners. So definitely people that lived there knew that there were police. But it didn't seem, I'm not sure, because I think there was like a methadone clinic there, and it seemed like people were kind of like looking a little high on the streets, and so it seemed like some of the residents didn't really care that the police were there. They were
Almost like
drinking.
they're just there to prevent like massive
Yeah.
crimes like shootings, not really to
Yeah.
cut down on the drug use or
Gotcha.
We saw strengths as it seemed like there were a lot of community health centers there as compared to other neighborhoods that we've seen. And like we said, it's between the 2 hospitals, Union Memorial and St. Joseph's Medical Center. So, if something does happen, it seemed like an ambulance could get there pretty fast from, either place. Multiple churches with different denominations. It seemed like through there were plenty of places to worship in the small, strip that we drove down on York Road just from seeing that. A variety of small businesses. So there were a lot of, which gives opportunity for, people that even live there to work there, or even, a lot of small businesses, or, so people maybe in the community own those businesses, which seem nice. They can support the small businesses. There was a lot of like hair places, beauty supplies, smaller stores for clothing, and things like that. Access to goods, and walkability of the neighborhood, right? So pretty much if you live around there, you could walk and get to a food place, a restaurant, a little store, and to buy things that you need, like the pharmacy, the CVS pharmacy, stuff like that. The risks, risks, so easy to access drugs, it seemed. by the way people were acting right there on the street. The age of the housing, we were concerned about. It looked like they were turn of the century, around 1930s, which we know that a lot of houses built before the 50s or 60s have lead paint issues and maybe asbestos problems, I would imagine. No large grocery stores.
One
so
more thing
there's-
about the housing, we didn't
sorry.
include in the PowerPoint, but we did notice most of the homes had security bars, at least on the downstairs and on the doors,
Yes.
on the windows and
Yep.
doors downstairs.
Okay.
They did.
Yeah.
And a statistic we found was 23% of those homes are rented. 77% have original owners that live there still. But 7% of the houses there are unoccupied, which creates a safety hazard, and also a place for squatters, right? And like, drug abuse. Crime rates, so the bars on the windows. I have a statistic here that the property crime there is 3,207 per 100,000 people, and in Maryland, the average is 1,950 crimes per 100. So it's almost double the amount of the Maryland um, statistic just for Govinstown. And then that was for property crime. So that's, houses, cars, I guess maybe cars getting stolen, stuff like that. Violent crimes are 1,272 per 100,000 people. And the Maryland average overall is 454 per 100,000 people. So it's over double the amount of the Maryland statistic right in Govinstown. There's not a lot of green space there. We saw a lack of parks, playgrounds, grass. It just seemed basically like a lot of asphalt and concrete. Median family income there is $41,000, and that's for a family. Yeah, that leads to health disparities, lack of insurance, money to pay medical bills, lack of maybe things to buy things you need. And the crime level influences interactions in the community. So we were thinking that if it's a higher crime level, people don't want to walk on the streets, people don't want to go outside, let their kids outside to play. So we thought that was definitely a risk. And to answer that one question about social determinants that impact health disparities, or I'm sorry, how personal perspectives influence interactions. So we thought a personal perspective, if there's a lot of crime, that's going to interfere with how someone goes out into the community and as what families do.
We were all hungry and we were like, don't think we'll go to eat here. So it definitely, influenced us just driving through the town to decide, okay, there's literally no women, no children on the street. As being 6 women, I'm not comfortable even just to go in and get a bite to eat.
Yeah.
So we also happened to get in a wreck.
You did?
Oh, yes.
We were involved in a hit and run, which
no.
fortunately the driver that hit and ran did come back about a half hour later, assuming because they realized that they lost their front license plate when they hit the car that hit us.
The license plate.
Oh,
It was great.
Yeah,
That was pulling out of St. Joseph's Hospital. We hadn't even done our windshield survey yet. This was before we even did the windshield survey.
Oh my gosh.
and the cop just looked at
You
us
guys
and
were all
went, "You in
together."
that car?" And
Yeah, we were all together in one car, all six of us.
sir, at seat 7 and with seatbelts, and he was like, "I was just trying to understand."
We thought we would add that into our, just as because it's funny when you look back on it, but it was
At the moment. it
interesting.
wasn't.
That's some
Yeah. Oh my
dedication.
gosh. Windshield survey wreck. Oh, oh my gosh. Oh, jeez. Mm-mm-mm.
I think it was interesting too that just the area that we were in, and we get in this accident, and it's a hit and run. Like I don't, I
Yeah.
feel like that wouldn't happen in all areas. Like if we were in Towson or, White Marsh or whatever, like,
Yeah.
I feel like people wouldn't hit and run.
Oh my God.
I think she
Well,
only came back because she figured out her license plate was left in the street and they were going to find her anyway. So I think she came back. I mean, that's just my opinion.
so,
Yeah, she said she went home to get her license and registration.
Yeah, or her
so
insurance
she
card
came
or
back and you
something.
guys were still there? That's unbelievable.
Oh yeah.
Yeah, we were there for over an hour.
Oh my gosh. Oh, jeez.
I gotta say that the ambulance response time was like on point, almost like they were leaving the hospital.
Oh my gosh. Well, I'm glad nobody got hurt. That's the important thing, that you guys didn't get hurt and you got your windshield survey completed. That was awesome.
I was a little shaken up by it, but it was like, we had a test to complete and we did it. So
There you go. Well, that was good. And so definitely some differences, huh, among the three neighborhoods that you all surveyed. And it just goes to show you where you live, how it can have such an impact on your health, right? And you're just in terms of the crime, the lack of public parks and green spaces and grocery stores. So you have your food deserts. So all of those things are so important to think about when you're caring for patients. And what is their background? Where are they coming from? And what can we do going forward to try and address some of those issues for people that do live in areas where there is, some of these increased risks that you mentioned in your survey for group 3, but all 3 groups. So, you guys did a great job. And so I will work on your windshield surveys and get those back to you in terms of your single ones. So good job. Anybody have any other thoughts or questions? Did you enjoy doing the windshield survey despite the accident? I hope your car's not too messed up. But did you all get some benefit from doing the windshield survey? Kind of really opens your eyes, doesn't it? When you
It was amazing to see the it was amazing to see the difference, like from just like a 5-minute drive from a good area to a not so good area.
Right.
Mm.
And we didn't even think about those things unless, it's brought to your attention by learning about, being aware of our communities and where we live and how it has such a profound effect on our, our health, our emotional health, spiritual health, physical health. It's all really, it's a great way to be able to recognize and see that and think about it as you're caring for patients in the future. And what kinds of things can you do as a nurse to help their access to care if they do lack access, or what education is needed by you as the nurse. So yeah, that brings us to the end of our community lectures. So you all have your exam on Wednesday. And does anybody have any other thoughts, questions, comments? Well, thank you all very much. Anything?
Sam, 45 questions, or is it going to be 60?
I believe it's 60. There are 60 questions. 2 of them are dosage. There's some dosage questions. It really covers the gamut of everything we talked about. Do make sure, because again, you don't have a book. The Henkel book, your med surg book, make sure you do the readings in them, because they do talk about, things that we've talked about, you will find in those books. So some of the information, just make sure you do your reading, so that will help you. I did open up all the other kind of study not assistive devices, but the help that you can get with studying. So just you can use those resources that I posted on Blackboard and have opened up. Okay. If you have any questions, you can certainly send me a message, email me. And I think that's pretty much it. So